Mm. Yeah. So good evening, everybody. So welcome to the final round of the Epignosis national level UG clinical quiz. So we had an overwhelming response in the screening round, which was conducted on Sunday via Google Forms. Almost 200 plus participants across the nation participated in the event. And so now here we have with us our top finalists, the top four participants and two privileged participants. So I take immense pleasure to introduce them to you all. So the first finalist is Mr. Debayan Banerjee, a fourth year MBBS student from St. GS Medical College, Mumbai. Welcome to you.
Thank you. It's great to be here.
Yeah. Second, we have with us Dr. Naveen Maurya, who is currently doing his internship in MBBS from Chamarajanagar Institute of Medical Sciences. Welcome to you, Naveen.
Thank you, sir.
Yeah, moving on, we have the third finalist, Dr. Kapil Chitade, who is currently pursuing his internship from Topiwala National Medical College and Air Hospital, Mumbai. Welcome to you.
Thank you, Kunj.
And the fourth finalist is Mr. Arun Ram, a fourth year MBBS student from MS Ramaya Medical College, Bengaluru. Welcome, Arun.
Welcome, sir, and I'm happy to be here.
Yeah, thank you. And we have our two privileged participants, Mr. Vignesh Prakash, a fourth year MBBS student from MS Ramaya Medical College, Bengaluru. Hi, Vignesh.
Hi, everyone. Thank you, sir.
Yeah. And our last privileged participant is Miss Neha Lakshmi, a fourth year MBBS student from PSG IMS College, Coimbatore. Welcome to you.
Thank you, sir. Happy to be here.
Yeah. And so moving on, we'll move on with the main quiz. So just to introduce to you all, the four main participants will attempt the main quiz. And if they cannot attempt or answer the question, then the question will move on to the privileged participants. And in some of the rounds, there are also separate questions for privileged participants. So just to make everybody included in the quiz. So hope you all have a great event, great time here. I'll just share the PPT. You all can see the PPT, right?
Yes, yes.
Yes,
Yeah.
sir.
So,
Yes.
And my friend Prathamesh, Dr. Prathamesh will keep a note of the scores and the timing. And so just to make it clear, the event, I'll just tell the rules as we move on with the rounds. Okay. So everybody ready for the quiz?
Yes.
Yes.
Yeah. So here we go with the final round. The first round is polish your mind. So basically in this, it's an explanation round where a statement will be given to you and you need to explain the reason behind why the statement is so. Okay. So the rules are as follows. So there are like four teams. So I to make it more clear. So that I just tell the order of the question which will be given to you. So team A is Debayan. So just remember your team number so that there's no confusion while we are conducting the event. Team A is Debayan, team B is Naveen, team C is Kapil, and team D is Arun. Okay. And so each participant will have to give a proper explanation, and only if the explanation is correctly explained, the marks will be given. So the marks for each, the one question is 10 marks. So there are 4 questions in all, it's like 10 marks for each particular participant. And you will be given 2 minutes for analyzing and answering the entire event. Okay. And there are no negative markings. And here the last 2 questions are solely reserved for privileged participants like Sneha Lakshmi and Vignesh. Okay. So shall we begin? Any doubts with respect to any of the rules?
If there are 4 rounds, then total 40 marks, right?
Sorry, not 4 rounds. There are 4 questions, like 4 You will like each participant will get one question. That's all. Like 4 questions
Then
for 4 participants and 2.
no, what is the total 30 marks? I didn't understand.
Just a second. Sorry, that's a mistake from my end. I apologize for that. There are only 10 marks for each question. Okay. So, Debayan, are you ready? I'll
Yes, sir.
project. Okay. So, the question is the pre-existing ABO blood group mismatch protects against RH-mediated immune reaction. Explain the statement. And the time has begun.
Whenever there is an ABO mismatch, whenever a person is transfused blood, the RH-mediated immune reaction, one of the requirement is that there is sensitization needed. So in the first transfusion, the person will not show any symptoms. So whenever there is RH-mediated blood which is transfused, I guess there are already antibodies formed. So in that way, the person is sensitized against the transfusion.
Yeah, that's also like basically this was with respect to in pregnancy, just with respect to in gestational transfusion or anything. Like for example, mother has ABO mismatch, the chances of RH immunization is less in case of infant. Like with, in that respect, you can try it again.
Yeah. No, I would like to pass the question.
No trying, like you can give it a shot. You are almost correct the first time, just with respect to pregnancy, if you could correlate.
Maybe like the antibodies which are already formed.
Like for example, just I'll clear the question. Like if mother is AB positive or like child, don't know, but the RH stands like there's a ABO mismatch between the mother's blood and the fetal's blood. The
Yes.
RH immunization chances are less.
Last 5 seconds.
Any
Actually, I'm not able to understand the statements.
okay. So shall we pass it on to the privileged participants then? Sneha Lakshmi or Vignesh, you want to give it a try? Sneha Lakshmi or Vignesh?
Is it related to some antibodies like IgM or IgG related?
Not exactly.
Can
I
we also give it a try?
maybe because there is hemolysis during ABO mismatch.
Yeah.
There is hemolysis during ABO mismatch.
Yes.
So the RH antigen is
Correct. You can complete the sentence. Yeah. So basically, reason is that because in the pre-existing ABO mismatch, there will be hemolysis of the RBC. So the RH antigen will not get presented to the immune system of the baby itself. So the chances of RH, like the first priming which you told, Debayan, that won't happen only because of lysis. Because the lysis, the antigen is lost itself. So the immune system will not recognize the RH antigen. That's why the RH-mediated immune response will be less common in the ABO mismatch between the mother and the child. So it's like a beneficial point from the fetal point of view. Okay, so you won't get any marks for this. And so moving on with the second question. Naveen, are you ready?
Yes.
Yeah, so this was the explanation. Why are only dexamethasone and betamethasone out of all the steroids given for lung maturation in case of premature infants? Like to like the steroids are given to the mother?
Because one, they are potent, they are very most potent ones,
Okay.
and they have got only glucocorticoid activity.
Okay. But any specific reason for why only, like most potent is one of the reason when glucocorticoid, but even other drugs are like also have a glucocorticoid action, like methylprednisolone also has a pure glucocorticoid action. So why are we not giving that?
They cross the placental barrier.
Yeah, that's the main reason. Correct. They cross the placental barrier and they also are not metabolized by the placenta. That's that two main reasons. Like they cross placenta and they're not metabolized. For other drugs like prednisolone and everything get metabolized. So they, even though they can cross, but they cannot eventually reach the fetus.
Yeah.
So you answered almost correct. So you get 10 marks for this. And
Thank you.
you got the reason correct.
Yes.
So now third question is to Kapil. Kapil, are you ready?
Yeah. Yes.
Paresthesia can be seen in case of respiratory alkalosis. Explain.
Okay. So H plus ions and calcium ions have a competitive binding with albumin in the blood. So in case of respiratory alkalosis, there is a net decrease in H plus ions in the blood. So that leads to the calcium ions binding to the albumin, leading to decrease in free calcium ions, which leads to paresthesia.
Correct. Absolutely correct. That's the correct answer. So you also get 10 points for this. The reason is what you explained. Great going. And the last question is to Arun. Arun, are you ready?
Yes, sir.
Dextrose 5% is not an ideal fluid to treat hypovolemic shock. What's the reason behind this?
Hypovolemic shock, there is loss of fluid.
Yes.
And does it have something to do with the osmotic pressure of like dextrose? Like you need something to draw more water. So I have a feeling that it might cause it pulls out water from the cells themselves, causing them to shrink. So you're just whatever fluid is already present in the hello.
Yeah.
So whatever intracellular fluid is already present, it is being drawn into the extracellular fluid. So it's essentially just cause. But if you give something like ringer lactate, for instance, it won't cause that osmotic drawing in of water into the vasculature.
Yeah, that's one of the reason. But that's the second reason. Like any primary reason for not giving it? Can you think of?
There is no wrong answers, right? You can keep telling.
Yeah. No negative markings.
Is it something to do?
Reasons. The second reason was correct, but the primary reason is a bit different.
Is it something to do with like glucose causing vomiting or something? No.
You're giving it IV, right? Wow,
yeah. Correct. That's all I can think of.
Sneha Lakshmi or Vignesh, can you think of anything? A primary reason?
DMAS, it causes hyperkalemia, so it might.
How hyperkalemia? There's only dextrose. Dextrose will go into the cells. There is no potassium itself, no sodium, no potassium, nothing. You have distilled water with dextrose. Khatam. Anybody else would like to give it a try? Come on, it's not like it's like learning event for everybody. So you can give it a
try. Maybe dextrose will give more energy to all the tissues, and it will use up more electrolytes.
Okay. Maybe, but
Maybe
not much. Should I?
maybe this is
Yeah.
the urine output
That he
through
Arun
SGM.
told, yeah, because osmotic diuresis will happen if you give more dextrose, so intravascular osmotic pressure will increase. So it will give a false feeling of getting a urine output. In fact, the patient is getting dehydrated, but you will feel okay, urine output is there, so he is properly hydrated. That would be a misconception from our point of view, treating physician's point of view. That's in linked with that, like that's the second reason. But the main reason is because dextrose, like it has dextrose and distilled water, right? Like the water. So dextrose will be absorbed by the cells. So eventually, you are only left with normal hypertonic water. That hypertonic water will move into the cells, causing like it is mainly used for intracellular dehydration. So intravascular volume will be still low only because all the water is hypertonic. Because dextrose is all left, is gone into the cells. It will move out into the cells itself. It will not correct the intravascular volumes. So that was the reason. So since you answered 50% correct, I'll give you 5 points for this. Arun,
Okay.
it's fine, right?
Yeah, we're cool.
Okay. So now we are like the privileged participant. So there are 2 questions for them. Vignesh, first goes on to you. You're ready?
Yeah, sir.
Yeah. So edema is not seen in case of primary aldosteronism. What's the cause?
Is this related to aldosterone escape phenomenon?
Yeah. Can you explain that?
Aldosterone helps in retaining of sodium.
Yes.
So to that there is water retention also, but because there is excess aldosteronism, primary aldosteronism means the aldosterone production itself is high. So that's for primary. And because there is too much aldosterone, the kidney will get desensitized to aldosterone, and that's called aldosterone escape. So because of that, there is no more water retention.
Correct. So body loses water. Correct.
Yes.
Good. So next is for Sneha Lakshmi. Ready?
Yes, sir.
Yeah. Why does high levels of lipoprotein A predispose to thrombotic phenomena? Any guesses?
Does it increase any one of the pathways of coagulation?
Not increase per se, but it is something with the coagulation. Like it's like it enacts like it's one of the part but does not act. It's like that Trojan horse phenomenon, like something like that. Maybe you can say.
Maybe it inhibits protein C to protein S conversion. Not sure.
Not of which I have read, so maybe some research may come up. I don't know, but up till now. Any guesses? Or anybody can, from the participants, can answer.
Is this something to do with Warsaw's triad?
Not exactly.
So shall I try?
Yeah,
It
definitely.
inhibits plasminogen to plasmin conversion.
Sorry. Come back.
Plasminogen to plasmin conversion is harmful.
What? Yeah. How? You are right. Path, it's correct. Like plasminogen doesn't convert to plasmin. So the anti-thrombotic phenomenon, which is normally happening in the body, that doesn't happen. Why? Anything? It's simple. Yeah, you just got it.
Lipoprotein A.
Lipoprotein A. So basically lipoprotein A, it's like it's the structure wise, it's just similar to plasminogen, but just it doesn't get converted to plasmin. It's like a inactive form of plasminogen. So it depicts like a plasminogen. So normal body will try to convert it into plasmin, thinking of it will get converted. But in reality, it doesn't get converted itself. So plasminogen will go on increasing, and the thrombus which may be formed in some vessels, it doesn't get lysed on its own. So eventually it can lead to a thrombotic phenomenon. Okay, so, and that's why just a additional point, it's also called as the little rascal from the movie which we have, some South Indian movies. Like, okay, that's the add-on point. So by the end, so that this culminates the first round of explanation round, polish your mind. So hope you all like this one of the event. And so the coming at the points, so Debayan is at 0, Naveen is at 10, Kapil is at 10, and Arun is at 5 points. Correct? So it's basically like this quiz is just like a learning event for everybody. Hope you like, nobody wins, nobody loses. You all are winners. Like came top 6 in out of 200 all over the nation. That's not a small thing. So just a learning event in a fun way. So moving on, we have a next round. This is a integrative round. Basically, just like sharpen your mind to think in all the different arenas which you can think of. So this is a round which has videos. There are 8 videos in all. So like 4 and 4, it will go twice. And so video round, the order remains the same. Just to prevent any confusion, I've kept the same order. And there's a normal video, like a movie thing, or also some day-to-day life going things. And there are, after the video is played, you will get 3 questions following that. And you need to answer the 3 questions. And the 3 questions are like 10 points each. So total you have 30 points. There are no negative markings. Okay. So Deban, are you ready?
I just have one doubt. Hello.
Yeah.
If we don't answer a particular question, the other questions won't be shown to us.
No, that would be shown.
Okay. So
And
we
if
can pass, right? If we don't know.
Yeah. Okay. Will do.
Okay.
So I'll play. This is the first video. You all can, 1 second. You can hear the sound?
No, I just can see the video.
The sound is, 1 second. You all can't hear the sound?
No, I'm not able to hear it. I don't know what.
Can other participants hear?
No, at least for the video, I didn't hear it.
Yeah, it's heard.
So now we can hear.
Yes.
You shall not harm Harry Potter.
Okay. Want to have a look once again? I can replay, or else after the video you can questions you. And one with the question.
Yeah, you can.
Okay. So question 1 is, if Harry Potter represents your urinary bladder and Malfoy represents an anti-cancer drug, then what does Dobby represent?
Dobby represents Messna, I guess. It prevents hemorrhagic cystitis.
Correct. Can you tell the full form of Messna if you remember? Just the additional. Marks won't be cut for that.
So it's something Mercapto. I'm not able to remember.
It's the reverse of Messna. Like Messna, MESNA. So Na is for sodium, and then MES like is sodium 2 mercaptoethane sulfonate. So sodium, just bring Na in front of MES. That's it. So second question, what is the class of drug and mechanism of action of the drug represented by Professor Malfoy?
So the class of drug is basically, it is cyclophosphamide. So it is
correct.
A nitrogen mustard.
Correct.
And it basically acts by, I guess, inhibiting the cell cycle at the...
Which phase?
I guess it basically causes some change in the DNA. N7 guanidine, it causes a change there.
So is it cell cycle specific or non-cell cycle specific?
Non-cell cycle specific.
Correct. It belongs to alkylating agent. Yeah. told the entire mechanism. Correct. That was very good. And the name the drug regimen used for Hodgkin's lymphoma.
It's basically the ABVP regimen: adriamycin, bleomycin, vinblastine, and prednisolone.
Well, correct. Very good. You get all 10 points, 10, 10, 10. So 30 in all. So Harry Potter gives you 10, 30 points. Okay. Coming to Naveen. Naveen, you're ready?
Yes.
These are the one sec. Yeah, just an additional point, like just there are no marks for this, but with respect to the same video, there's one more question. Anybody can attempt. Even we start with the privileged participants first, if they can attempt. Correlate this with the clotting mechanism taking place normally in the body. Who is Dobby in our body to protect Harry Potter from untimely death? Because premature death of Harry will also cause severe instability in the body, just like it would have caused in Hogwarts. Any takes from Sneha Lakshmi or Vignesh? Come on, think in some like thought in your mind and the normal clotting mechanism. All of you can think, because if they can't, you can answer it.
Platelet plug.
Yeah, can you just explain it?
Because if platelet plug is not there, then platelet plug will first plug the bleeding before the clotting actually starts. So if Dobby is not preventing, and the platelet plug is not preventing that, they will bleed to death. So
Harry is what then in this case? Who is this? I can't see your video. I couldn't see.
Yeah, Vignesh, sir.
Yeah. Like there are two answers which can be possible in this case. Like just tell me who is Harry, who is Dobby, and who is Malfoy.
Harry Potter.
Like multiple
idea,
answers
sir.
can be there. Achha. Anybody else? Sneha Lakshmi? Or anybody of the top 4 participants? Come on, yeah.
Harry Potter is the vessel for the blood. Is the blood vessel. So Dobby comes as a platelet and stops the injury from causing further bleeds till the clotting mechanism of Hogwarts comes into play.
Correct. Even that can be one of the answers. Should I tell what I thought from this? Yeah, so like basically Harry can be like a factor 8 and Dobby can be a 1 billion factor. So basically T half of factor 8 is prolonged by 1 billion factor by the normal mechanism of the body. Malfoy represents the body. That is one of the things which can also be there. So just on a short fun note. So moving on, Naveen, are you ready?
Yes.
This is a video. Okay. Ready?
Yeah.
First question is, which semicircular canals are active and what is the direction of the crista ampullaris in the respective canals? Tell me with respect to the utricle, towards, away, or whatever. Not moving.
Like, what does it mean by
Like,
active?
Means which semicircular canals are involved primarily for maintaining balance in this particular dancer.
Okay. Superior is for horizontal stability.
Are you asking or answering? You need to answer. I'll not help you in this. Like which semicircular canals are more developed in this dancer?
Lateral semicircular canal.
Yeah. And what's the direction of the crista ampullaris? Like in the right and the left here. So the right semicircular canal and the left semicircular canal. Come on, it's easy.
Like what basically is meant by direction?
Means your crista ampullaris will move, right? The jelly and the ampullaris moves when you have your head movements, right? So where will it
Yes,
move?
yes.
So in this particular dancer, when she is dancing, what is the direction of the movement?
It's left to right.
Yeah, but the right and the left, what's the movement? Do you pass or should I to the next question?
Next question.
What's the absolute contraindication for performing doll's eye reflex? And how will you perform BOR in them? What's the contraindication first? You know doll's eye reflex, right?
Yes.
So what's the one absolute
Last 1 minute.
Eighth cranial nerve injury.
Why?
Because of doll's eye reflex is mediated by eighth cranial nerve.
Okay, but that would be not an indication of doing only, that why will you do in that? Like there's an indication, but you cannot do. That's a contraindication. Like the reflex is normal, everything is normal. The pathway is normal.
Spinal cord injury.
Yeah, correct. You cannot move the head. That's it.
Cervical.
Yeah. So how will you perform BOR in them? The vestibulo-ocular reflex. The dorsal reflex is basically the vestibulo-ocular reflex. So if a spinal cord injury is there, then how will you do a BOR?
Time is up.
By using water, like cold and hot.
Correct. Caloric test. Okay. And since time's up, but okay, you can just take up the last question if you can answer in last 30 seconds. So the answer is at a risk of tendinitis of which? Achilles muscle.
Gastrocnemius.
Not so. That's the wrong answer. So basically, the muscle involved, I'll just show you with the diagram. So basically, coming to the first question, the direction of crista ampullaris is with respect to the utricle. So since it's rotating, so it's rotating from left to right. So left will be away from the utricle and right will be towards the utricle. That was the answer which I wanted. Since you didn't answer, you get 5 points for this question. And coming to the second part, second you got entirely correct. And third is actually flexor hallucis longus, because did you see the ballet dancer? It was a fully plantar flex. That's why most commonly they have the involvement of this muscle, flexor hallucis longus. So you get 10 plus 5, 15 points for this. Okay.
Yes.
Yeah. So Kapil, are you ready?
Yeah.
So your video is this. There's no sound to this. Okay, I'll project the
Okay.
questions. Considering the batten is a vitamin, what would it most likely be?
Too many things.
The one thing, think, use all your, whatever you want to use, all your parietal lobes, frontal lobe, anything.
Can legit be too many things, but I'm going to go with probably folic acid or folate,
Why? Why folic acid?
because again it's rotated into that tetrahydrofolate and dihydrofolate, so it keeps on passing between those two forms.
But the once it's rotated, the form gets changed, right? The tetrahydro gets converted to dihydro, then methyl THF and all those things. Your batten is remaining
Okay.
the same.
Oh,
Like the same batten is being
same,
transferred
right.
everywhere. Would you like to pass that the privileged participants can answer? Take your time. Just Sneha Lakshmi and Vignesh be ready. Just be ready.
There's too many things which can, but
What can it?
all of them will play some role in some reaction, so all of them can be as a batten.
But the batten is remaining the same, right? But the form of the vitamin is not changing. Though the carriers are changing, the form is not changing. But basically the compound is remaining the same, not getting converted to anything.
Okay.
As a hint, you can take it, suppose, in absorption of the vitamin. Then you can narrow down. Or should I give it to Sneha Lakshmi or Vignesh?
Yeah, you can pass.
Sneha Lakshmi or Vignesh?
Sir, is it vitamin B12?
Why so?
So because it will be bound to intrinsic factor, it will be bound to then transcobalamin.
Okay, correct. It's vitamin B12.
Yeah.
And so can you just name the, if batten is represent vitamin B12, what would the relay racers represent? Tell me everything from top to bottom. In the pharmacokinetics, name all the carriers.
I am supposed to answer this?
Yeah, Kapil.
Okay. Yeah. So once you ingest the B12, you have a salivary, which I don't remember. Okay. Then it goes to the stomach where intrinsic factor is released, binds to intrinsic factor. And
Okay.
then in the intestine, it binds to
Yeah.
transcobalamin and then thing transport.
Okay.
I don't
Well,
remember.
that's it. It's skipping and going.
Yeah.
Okay, so the correct answers are like first it binds to haptocorin from salivary amylase, then from the stomach intrinsic factor as you told, but it binds in the small intestine, not in the stomach.
Yeah.
And then it binds to the tubulin receptors in the ileum. Then from there, from transcobalamin. So you made the B12 skip 2 parts. Okay.
First racer to final.
Sorry?
First racer to direct final race.
Yeah. Yeah. So you'll get how much? 5 points for this. You've answered only halfway. And the third question is, this is a case. So deficiency of which form of vitamin B12 can lead to the following presentation and how? So case is a 31-year-old male presented to the casualty with difficulty in moving the right upper and lower limb since waking up. Also, his left lower half of face is paralyzed. He was absolutely normal at 11 p.m. the previous night when he went for sleep.
Time is up. Should we still continue?
We'll give it 1 minute for this because the past questions took time. That's all.
Which form of vitamin B12?
Means adenosylcobalamin, methylcobalamin. There are many types, right?
Oh, okay.
Can you diagnose the case first?
This looks like subacute combined disease, of course.
How? Subacute means what?
Oh yeah, it won't be this.
Because it was normal at 11 p.m. the previous night.
Yeah, it's immediately
Acute. It's acute.
correct.
So SSED gets ruled out. That's not the
Right.
diagnosis.
I don't have an idea.
Any guesses about how vitamin B12 acts in different mechanisms, reactions? No?
Can't think of anything right now.
Okay, Sneha Lakshmi or Vignesh, would you like to give a try?
I think it is homocystinuria causing thrombotic stroke. So
Correct.
it might be methylcobalamin.
Correct. That's the correct answer. Yeah, there's a trick question here. It's not SSCD because many people go wrong in here. So you only get apparently how many? 5 points for this. Okay. And coming to the last, Arun, are you ready?
Yes, sir, I'm ready.
Yeah. So this is the answers, and this is where the homocysteine binds. And this is like, just to remember, it's a NEET PG question also, one of the previous year questions. So good to know. It will help you in your upcoming NEET. This is the question.
No. I'm driving.
Okay. So
Great.
we'll move on. So what's the drinking limit of alcohol Mr. Bean is talking about in India?
It's for drunken driving, the limit in India.
Yeah.
Yeah, it's less in India. I think it's around 30 mg per deciliter.
Correct.
Yeah.
30 milligram %. And what is this logo about?
It's a sunflower.
Yeah.
Pertaining to alcohol, my guess would be Alcoholic Anonymous.
No, that is AA.
Okay. Is it something to do with like preventing accidents or something?
No.
Is it from community? It's from community medicine.
Yeah, it's from community medicine.
Yeah. Sunflower, I can't think of.
Okay. Sneha Lakshmi or Vignesh, would you like to try? These questions many times crop up in your IBQs in NEET, image-based questions. No guesses? Come on, I'll give you a hint. It's from psychiatry. What is psychiatry all about?
Is it Mental Health Provision Act?
Yeah, National Mental Health Program.
Do I get points?
You won't. And the third question is, enumerate the stages of alcohol withdrawal.
Stages?
Yes.
Like delirium tremens, like that, or?
Yeah, means the order in which they appear.
Oh.
Like a chronic alcoholic came and now you stop drinking. Correct order will give you marks, not the.
Oh, okay. Is it like symptoms of alcohol withdrawal, like flushing of face, tachycardia, like that, or?
Yeah, the stages. You can. There are names for the stages.
Oh, is it those different Mad as a Hatter, Fox,
No.
something?
That is it in atropine toxicity, not in alcohol. No.
Acute, chronic. I don't know.
Vignesh or Sneha Lakshmi?
Is it that sober, euphoria, excitement is?
That is for intoxication. This is I'm asking for withdrawal. Like the ecstasy and everything goes that.
Stage of delirium.
That's the last stage.
Confusion, stupor, coma.
Okay, that's pretty late, not immediately.
Tremors, the first one.
Sorry, come back. Vignesh was answering, right? Any of the participants who would like to take this?
I think
like there is first tremors, then there is
correct.
After tremors there is alcoholic hallucinosis.
Somewhat down the line.
Then we have rum fits, like seizures after 2 days, and finally after 3 to 5 days delirium tremens.
Correct. Yeah, you are almost right. So the stages are tremors, autonomic hyperactivity, which includes flushing and palpitations and what Arun was explaining. Then alcoholic paranoia, which are fixed delusions, followed by alcoholic hallucinosis, TTCS, and delirium tremens. So delirium tremens usually happens after 72 hours of withdrawal. And the first symptom, the most common symptom is tremors. This is also usually asked with the timeline in your NEET PG exams. So it's a must know for the NEET PG aspirants. Coming to next. So now we'll again go. So by the way, here Arun will get just 5 points. Okay.
Yes, sir.
Yeah. And so coming down again to Devayan.
Every correct is 10 points, right?
Sorry, 10 points. Yeah.
He gets first question.
Correct. Sorry, my mistake. So 10 points for him.
Thank you.
Yeah. You should thank Kapil.
Thank you, Kapil.
It's all fair game.
And coming down again, the question will go on to Devayan. The rules are same. So are you ready?
Yes.
अरे सुनो, पूजा के आने के खुशी में आज ऑफिस में वो बांटेंगे, वो टेनिस बॉल नहीं वो पेपर वेट लड्डू है ना भाई साहब? हाँ, लड्डू बांटेंगे। हाँ, वो भी तो गोल होता है, दुनिया भी गोल होती है कि वो बांट दें।
The questions are: name the clinical condition the lead actor is suffering from and the site of lesion.
Like he's not able to name that particular object.
Yeah. So what's the name?
Aphasia.
Yeah. Correct.
Site of lesion, angular gyrus.
Correct. That's good. You get 10 points for this. Second question: the lesion in the lobe where the gyrus above is mentioned, means the angular gyrus, will produce which type of visual field defect?
So angular gyrus is basically located around the region of the occipital lobe. So like temporo-occipital, that area.
No.
Parietal lobe, then we'll have pi in the...
Pi where?
Like we have quadrantonopia, inferior quadrantonopia, pi in the floor.
Pi in the floor, correct. Pi in the sky would be temporal lobe, and pi elsewhere is different only. Correct. You will get 10 points for this. And this is the case. In a casualty, Mohan is opening his eyes to painful stimulus, abusing nurses and his relatives. On stimulation, his limb shows normal flexion attitude. On seeing the pupil, both pupils are reacting normally to light. what is the GCS score? I want it in EVM, not the number.
Is it E2V4M3?
No, that's a wrong answer. Sneha Lakshmi or Vignesh, would you like to try?
Is it E2, V3 and M4?
Yeah, that's correct. So can you explain, like, it's nothing to explain in this. Okay. So basically, maybe you must have gone wrong in normal flexion and abnormal flexion. So that's correct. So you get 10 plus 10, 20 points for this. So this is a pi in the floor, and this is the EDM. And the GCS score is this. I is to sound, pressure, verbal is words. That's why it's confused and words. And normal flexion and abnormal flexion. So you always take which is higher in that particular component. So it becomes E2, E3, and 4. Okay. And it's also a must know question. Many of the questions in NEET come on from this. They just confuse you with confusion, words, sounds, and some easy marks get lost. So just make sure to learn this by heart before you go for your any exams. Okay. So you get 20 points for this. Debayan. Coming to Navin. Navin, you're ready, na?
Yes.
Yeah, this is the video. There's no sound for this. Okay.
Yeah.
Correlate a condition in dermatology and name the test and the sign.
Scratch test.
In name everything.
Is it Koebner phenomena?
No. It's like the most common thing we see in OPDs. No.
Is it something to do with scratching? Active
Yes.
vein flare.
Yeah, scratch test.
Area.
Scratch test, I take the answer. But what's the condition and the sign? No.
I'm not able.
Acha. Sneha Lakshmi, could you try? You were like smiling a lot.
Auspit sign seen in psoriasis.
Yeah, correct. And that test, there's a name for the test. Can you just name that? Yeah, Gratach test. In psoriasis, you just rub the. Yeah. So, and the name, this sign, and the sign, it's a photo here.
Gratach. Okay.
No, this.
Is this Koebner's phenomenon?
No. Koebner's phenomenon, it looks like the parent lesion. There is no parent lesion here.
No, pass.
No pass. Sneha Lakshmi or Vignesh?
Are these apple jelly nodules?
No, that's seen on the putting the
Slide.
slide
Yeah.
in lupus. Lakshmi or Vignesh, would you like to?
So is it annular lesion?
Not likely. It's linked with psoriasis, doctor. Any participants?
Voronov rings.
Seen in? Voronov sign is correct. This is seen in which condition of psoriasis?
There is immune complex. There is a rim of hypopigmentation around that lesion.
Yeah, correct. It's a part of healing, basically.
Okay.
It's in healing psoriasis.
After the plaques.
Yeah, correct. So, okay. And the last question is, 15-year-old boy came with intense itching on the scalp, and this is the scalp on examination. And what is the diagnosis and the causative organism?
Is it fungal?
Yeah. What's the diagnosis?
Kerion?
No, Kerion is like a boggy swelling. This is not boggy anything. There's no swelling also. No intense. Like that's a cause of alopecia, non-scarring alopecia. Any of the privileged participants would like to take?
Is it tinea capitis?
Yeah, correct. And like, could you name that particular type? There are 4 types. Kerion is one of the part.
Malassezia fur can cause it.
No, that will cause scaly lesions on the skin. No?
Trichophyton. Epidermal.
Yeah.
Dermatophyton.
Yeah. That trichophyton is correct. The diagnosis tinea capitis. There are 2 types, right? Scarring and non-scarring alopecia. Scarring has Kerion and one is flavus. And this is gray dot and black dot. You have 2 things, right? So this is that gray dot. Basically, you can see the dots. Gray dots represent like the cut off hair follicles, the hair which is coming out. So it's cut off. So on the top view, you can see multiple black dots here and there. So that's tinea capitis, black dots or gray dots. And the organism is trichophyton or tonsurans or violation. It's one of the type of dermatophyton. Okay. Found it very tough or what, Naveen? Okay, never mind. Just keep it in mind because these are good to know topics. And most of the times the images do come in the IBQs, in the MCQ exams. Okay, so we'll give you 3 marks for the test, the Grattage test, and rest you didn't score, but never mind, you have rapid fire to cover on. Okay. So coming to Kapil, the third video.
आप बैठिए, मैं आपके लिए पानी लाती हूँ. पानी नहीं हो सके तो थोड़ा सा दूध दीजिए. इतनी सुबह कोई दूध की दुकान खुलती नहीं है ना. अच्छा, तो फिर कल रात को लाकर रखना चाहिए था. रात को लाते तो रखते कहाँ, फ्रिज तो वर्ली में है. क्या मतलब? हमारा पूरा सामान वर्ली से शिफ्ट नहीं हुआ है ना, और घर में दूध है नहीं तो चाय कैसे बनेगी. और डॉल की तो बिना चाय के आंख ही नहीं खुलती. डॉल जी, मेरी पत्नी प्रेमा शालिनी, प्यार से डॉल कहता हूँ ना. हो अच्छा. हाँ, तो आप डॉल के पति हैं? जी हाँ, क्यों लगता नहीं हूँ ना? नहीं, लेकिन ये सच है.
Okay, so had a fun time, huh? Okay. The questions are: what is the peculiar abnormality depicted by the male character in the clip? The white.
But peculiar abnormality, probably.
Did you find him normal?
Tuberphonia or something?
Yeah, Correct. Puberophonia. Correct. And name the test performed to see if the individual has scope for surgery.
Oh, it's that pressure test, right? You put pressure on the larynx, and if the sound deepens, then you have scope for surgery. But I don't remember the exact name.
Okay, we'll give you. But the pressures. The name is Gutman's pressure test.
Gutman's pressure.
Gutman's, yeah. But the concept is correct, so you get the points. Name the surgery which can be performed.
Oh, okay.
Yeah.
I think okay, forgot the name of the surgery, but basically shortening the vocal.
Yeah.
So type 3
yeah.
of
Thyroplasty.
Thyroplasty type 3.
Correct. It's type 3. Correct. You get all 3 points or 3 questions correct. So 30 points for you. Good cover up in the next video round. Good.
Thanks.
Arun, you are ready now?
Yes, I'm ready.
So this is your video.
Yeah, yeah, yeah. Yeah, yeah, yeah.
ये राजू मेरा पैसा देखो मेरा पैसा
ऐसे बोलो, दीवारों के भी कान होते हैं। ऐसे बोलो, ऐसे बोलो। क्या हुआ? वो क्या जोर से बोलो, कुछ सुनाई नहीं दे रहा है। जोर से बोलो।
मेरे को सपना गिरा कि ये राजू मेरा पैसा लेके भाग गया है।
Okay.
Yeah. Got it.
So what did Babu Rao just experience?
Because of shock, he suddenly lost his voice. Is it that one, or is it waking up suddenly from sleep? Which one is it?
Sleep phenomenon.
Waking up from sleep, nightmares?
Correct.
Yeah.
Not night terrors, that was the thing.
Yeah.
And which phase of sleep was Babu Rao in? And what is deep sleep?
Babu Rao, I think, was in REM sleep for nightmares.
Correct.
And deep sleep is it the deep slow wave sleep where you have
like the stage names?
Yeah. It's NREM and REM. In NREM, you have stage 3, I think. Alpha. First, you have alpha waves. Then you have delta and theta waves. Yeah.
Correct. So stage 3 and stage 4, basically.
Yeah, stage 3 and 4.
More so 3, more than 4. That is.
Yeah.
And in which phase of sleep the following EEG finding is seen?
Is this stage 2?
Of NREM.
Yes.
Yeah, correct. What is the finding? You get points.
Sleep spindles and K complex.
Correct. So you answered all 3. Yeah. Good cover up in the second video round.
Yeah. That was the first one or the second Era Fairy? Out of curiosity.
I think it's first.
Okay. Thank you.
Okay. So these were the answers. And so we have something for you all also, Sneha Lakshmi and Vignesh. Hope you must have liked this video. So one for you all as well. So first we'll go with Vignesh.
Yes, sir. Yes, sir.
So what's the condition the actress is suffering from?
I think narcolepsy.
Why narcolepsy?
She's sleepwalking, maybe.
But narcolepsy happens like there is sudden fainting movement where all the muscle tone falls. The muscle tone is not falling. The sleepwalking is correct. So sleepwalking doesn't happen in narcolepsy, does it? I don't remember. Yeah, like sleepwalking is the answers, which is called as somnambulism.
Somnambulism.
Yeah, that's the condition. I didn't ask for the diagnosis. Narcolepsy doesn't have sleepwalking. It's a different tetrad for that.
Okay.
Where is this seen? In which stage of sleep?
I think it should be in stage 2 or something. 2 or
No.
REM
It's not.
sleep.
But REM mein to all muscles are gone only. How will she?
Correct.
Otherwise, you would be running in your sleep, dreams.
I don't know, sir.
No, it's in deep sleep.
Numbers, so no.
Yeah, it's in deep sleep basically. NREM 3 and 4. And this polysomnography was done. And what's the column 2 representing?
It's REM sleep.
Correct. And column 1 and column 3, just out of
Because
curiosity.
electrooculography, there is movement.
Yeah. Yeah. Column 2 is correct. I give it to you. It's REM sleep. But 1 and 3, can you just answer out of curiosity?
One, maybe it's been for the stage 2 of non-REM sleep.
Okay. But
EEG.
EEG is also there, no? EEG is NREM is what? Non-eye movements, non-rapid eye movements. EEG
Oh,
should be
right.
Mhm.
The waking stages of REM sleep.
Sorry?
The waking
Come back?
stages of REM sleep.
Yeah, the awake state basically. Normal awake stage. Yeah. And 3
Okay.
would be likewise.
It is non-REM sleep, stage 2, I guess.
Anything. There is no specific for that. NREM.
Okay.
Correct. Good. So this was the interpretation which you answered. So Sneha Lakshmi, last video question for you. Ready?
Yes, sir.
Hope you like this.
जन्म से लेकर 5 साल तक की उम्र के बच्चों को 7 बार टीकाकरण के लिए लेकर जाना है। 7 बार में से एक भी छूटना नहीं चाहिए। ये जिम्मेदारी हम सबकी है। इससे जरूरी कोई काम ही नहीं है। आखिर बच्चे के स्वास्थ्य का सवाल है। तो इस बात को अच्छे से समझ लीजिए आप। ये जो बीच के टीके भूल जाते हैं ना, ये देखिए अच्छी बात नहीं है। सारे टीके समय से लगेंगे, तभी जानलेवा बीमारियों से बच्चों को सुरक्षा मिलेगी। ये सब लिखा है इस कार्ड में। 5 साल 7 बार छूटे ना टीका एक भी बार।
Okay, so first question would obviously be which card?
The vaccination card.
Come on, that's not called as vaccination card.
Universal immunization card is the name for the card.
Yeah, that's the name for the card. That's not the NIS is not the card. That's the scheme. National Immunization Scheme. No? In OBGYN postings, we see, no? They bring that card, that green colored card. What do you call that card? Anybody else would like to answer?
Maternal child
card.
Mother and
Thai
Child
card.
Protection Card. MCP card.
MCP.
Yeah. Got it. So next question. Name all the live vaccines given under NIS.
OPV, MMR,
Yes. 2 you answered.
PCV,
It's a conjugate vaccine. The name says conjugate. How can it be live? There's no hyphen to think. Start from the birth.
BCG,
Correct. That should be the first answer ideally. BCG, OPV.
rotavirus,
Correct. And one more. Usually don't give it in India or in Maharashtra. But
meningococcal.
is that under NIS? No.
Japanese encephalitis.
Yeah. 5 basically. You can just remember from birth to whatever which is asked. And second question. Jay comes on his first birthday to you. He hasn't received any vaccines yet. What all vaccines will you administer him today?
BCG, because it can be given till 1 year.
But first birthday happened. No?
Okay. So, hepatitis B, OPV can be given.
Hepatitis B you will give?
No, pentavalent should be given. Hepatitis B.
Do you want to?
Then
One is OPV, correct. Penta there's not, there's a different thing, I'll tell you. You don't give penta.
EPT,
Yes,
MMR,
correct. Anything else you want to give?
no, enough.
Yeah.
Maybe
So
PCV we can give.
PCV you may, but actually as per the current guidelines, like in private practice you can give, but in normal private, I don't know about private, but about in NIS in government setups, there's a package rule which is followed. So like 6 weeks ka vaccine, all are given together, all or none. If bachcho comes at 6 weeks, then you give, otherwise you don't give. So IPV, PCV are all given if the child comes at 6 weeks with OPV, DPT and OPD and Penta. Basically, you will give OPV, DPT and MR in this case. Okay, so that's a new update in the NIS schedule. And as per the latest guidelines, where, when, and how will you administer FIPV booster? This can be a probable NEET question. Maybe.
6 and 14 weeks.
Booster. That's normal FIPV. It was introduced in Jan 2023. First Jan.
IM.
FIPV, how will you give IM? Why is the F for that? F is for the reason, no fraction. IPV is IM, FIPV is ID.
Subcutaneous route.
No, FIPV is fraction. Out of 0.5, you only give 0.1. And 0.1 can be the max you can give intradermal, otherwise skin will burst. So there's no use of giving more than 0.1.
Oral then.
Sorry?
Oral.
No, I told you it's IM or ID.
Okay.
And inactivated, you cannot give it oral because it's inactivated. What's the use of giving it oral? No? Okay. Should I ask others? Kapil? Kapil,
Yeah.
since you're using your hand, you can answer it.
Yeah. On first Jan, they said at 9 months you have to give a FIP booster.
Yeah, 9 months.
So,
yeah.
Left
Where?
upper and ID.
Left
Left
upper.
upper arm.
Left upper arm 0.1 ml ID. So that's the update. In left, you only give 2 things, BCG and FIPV booster. Rest, MR, MMR, everything, and Japanese encephalitis, FIPV normally goes in your right upper arm. So just to prevent any confusion, it's given in the left arm. Okay. So that marks the end of the video round. Hope you all enjoyed a novel idea of integrating different things together in a day-to-day life. So now coming to the final round, the rapid fire round. So the last do or die question, the do or die round for each and every top 4 participants. So this is the rapid fire. So 100 points would be for that. So coming on to the rules, just listen to the rules carefully. The set of 10 questions will be projected in the screen, one after the another. Total time to answer all the questions is 90 seconds. Only the first answer spoken in the microphone will be accepted. No other all answers will be marked as negative. In case of participant doesn't want to answer, he can say pass to move to second question. And pass question can be answered only after attempting all the 10 questions in sequence. So 10 marks for each question. So in all, 100 marks. Okay. So rapid fire will begin with the team with the lowest marks. But since I have not calculated the entire marks, so we'll begin with Debayan, followed by Naveen, Kapil, and Arun. Is it fine? Okay. So Debayan, are you ready?
Yeah, I'm ready.
Prathamesh, are you ready?
Excuse me, hi. If I pass it, I can come back, right? If the time permits.
Yeah, but after the 10 questions get completed in order.
Okay.
Prathamesh, are you ready?
Yeah. Let's begin.
You just let me know when to begin.
All right. You can start.
Yeah. Name the national program, full name.
The Pradhan Mantri Surakshit Matritva Abhiyan.
Sorry, that's the wrong answer. Where is bag of one's appearance seen in stomach?
Pass.
Classification used for peptic ulcer localization.
Johnson classification.
Correct. Katayama fever is due to?
Schistosoma.
Correct. Valve of Hista is located at?
It is located in the neck of the gallbladder.
Correct. Name the eye sign in thyroid eye disease. Edema of lower lid is called as?
The Endroth sign.
Correct. Von Cosa stain is used for?
Calcium.
Dash kit is used for genital herpetic ulcer.
Red.
Correct. Name this instrument.
Pass.
Name the fracture.
Green stick fracture.
Correct. You are left with second and ninth.
Bag of appearance, it is GAV, gastric antral.
No, that is watermelon stomach, not a bag
Last
of.
10 seconds.
Ninth question to go.
Is it lung forceps the instrument?
No, it is finished. It is lung finished. So time's up. So I'll come up with the answers. The first is Pradhan Mantri Matru Vandana Yojana, not the one which you spoke. Second is menetrious disease, and rest are correct. And the ninth was green Armitage forceps, the ideal forceps which are used to secure the angles in LSCS. The lung forceps are very wide. They are finished in between, not this. Okay. So you answered 3 wrong. So you get 70 points for this. Okay. Good. So coming on with Navin, are you ready?
Yeah, ready.
Prathamesh, ready?
Yeah, let's start.
Name the program, national program.
Pass.
Bag of worm's appearance on palpating scrotum is seen in?
Varicose.
Sorry, I can't hear you.
Varicose.
Correct.
Hello.
Classification.
Hello.
Correct. Classification used for fistula in Ino.
Parks classification.
Okay. Nagayama spots are seen in?
Measles.
No. Valve of Gerlach are located at?
Valve of Gerlach. Pass.
Name the eye sign in thyroid eye disease. Difficulty in everting upper eyelid.
Last 30 seconds.
Von Graffe.
Wrong. Pulse Prussian blue.
Iron.
Correct. Dash kit for vaginal discharge.
Green.
What's this forceps?
Welsh.
Wrong. Name the fracture.
Holstein. Lowe Holstein.
No, that's incorrect. So coming to the, do you want to attempt anything again? You can attempt 1 and 5.
Valve of Gerlach.
Your time is up.
Okay.
Finished off. Yeah.
Yeah. So you didn't answer 1. So the answers are as this. PM Surakshit Matritva Yojana, which Debayan answered in the first round. And that you didn't answer. Then varicocele you answered. Park classification you answered. Fourth you didn't answer. That was roseola infantum, like 6th disease or exanthemum subitum. Valve of Gerlach is in appendix, neck of appendix. The sign is Gifford sign, everting the upper eyelid, which you didn't answer that as well. Green kit you answered, pulse position for iron. Ramplis, and that was Stoffer's fracture, the fracture of radial styloid. You can see it here. The styloid gets fractured. So you are 9 and 10. So 1, 4, 6, 1, 4, 5, 6, 9, 10. 6 questions, 4 questions you answered correctly. So you get 40 points for that. Okay.
Yeah.
Coming on to Kapil. Ready?
Yeah. Yes.
Yeah.
Yeah,
Prathamesh,
let's start. Yeah.
name the program, national program.
Skip.
Bag of worms appearance in lingual muscle. Say name.
Skip.
Classification used for political cyst.
Todan is modification of Alonso-Lodge.
Correct. Kanagawa phenomenon is seen in shown by
Vibrio.
which?
Vibrio cholerae. Vibrio
Wrong.
parahemolyticus.
Valve of Hasner is located at?
Inferior portion of the NLD.
Correct. Name the thyroid eye disease. A sign.
Pass.
Okay. Oil red sign.
Fat.
Oil. Correct. Dash kit is cervical discharge.
Kit 1.
Sorry.
Kit 1.
Which is
Gray.
Name. Correct. Name the instrument.
Okay, pass.
And
20
name
seconds.
Name the fracture.
Galaxy.
No, that's wrong. You can attempt 1, 2, 6, and 9.
Lingual muscle is
Time's up.
Okay, so first of all, coming to the answers. The first was National Iodine Deficiency Disease Control Program. Second is acute rheumatic fever, the bag of worms in heart. Then political cyst you answered. Kanagawa was by Vibrio parahemolyticus. You answered Vibrio cholerae. So that would be wrong. Then valve of Hasner you attempted. Then in TED it was Jellinek sign, hyperpigmentation of superior eyelid. Oil red for lipid, gray cervical discharge. And the fracture was nightstick fracture. It was fracture of the ulna, not the radius. If it would be radius, it would be Galeazzi. It's like the person is protecting himself from the fracture. So ulna gets hampered. And the forceps was political forceps. So you answered 1, 2, 3, 4, 5, 6. 6 questions were not answered, so 40 points for you.
Okay.
40, no? Third you answered, fourth Nick went, third, fifth.
And I got wrong.
Yeah. Okay. So last is with Arun. Arun, you are ready?
Yes, sir.
Prathamesh.
Begin.
Name the National Health Program.
Skip. Pass.
What is bag of worms appearance in heart? Okay.
Pass.
Classification used for achalasia.
Pass.
What kind of disease is used to?
Pass.
Valves of Kirkings are located in?
Pass.
Name the eye sign, inability of convergence.
Pass.
Okay. Mason trichome stain is used for?
Collagen.
Correct. Dash kit is for genital non-herpetic ulcer.
White.
Okay.
White.
Yeah.
Kit number 3. Kit number 3, no. This one, I don't know the instrument. Pass.
Name the
fracture. It's ovum forceps. Bag of worms appearance. Wait, what kind of disease? Valves of Kirkring is seen in small intestine.
Correct.
Then is the logo Ayushman Bharat.
No, that's wrong.
Okay. VFib. Backworms. Backworms is VFib.
Time is up.
Okay. So do you want to attempt? I show the answers.
Inability to converge. Is it Joffroy sign?
No.
Okay.
So
Wow.
I'll go on with the answers. So one was Poshan Abhiyan, PM overarching scheme for holistic nourishment.
Yeah.
Second was atrial fibrillation. That you could have easily answered. Lago forms in the heart. Then one was Chicago classification for achalasia. Vakana is by oral infection of hookworm. The curved rings you answered correctly. Small intestine.
Yeah.
The eye sign is Mobius sign. You answered something else. So that was wrong. Trichome for collagen, you get that. Blue kit for there's blue and white kit, depending on penicillin allergy or not. So I give that points to you. And ovum force, and that was Colles fracture.
Oh.
The fracture at the metaphysis of
But isn't the ulna also fracture in this?
Yeah, it's along with that. Yeah. I think that there's no different name if both get.
Yeah, there is. It's Colles plus ulnar fracture.
Yeah. Okay. So you answered 4 questions, correct?
Four questions. Yeah.
So you get 40 points for that. Okay. So here we wrap up the main quiz. So I'll calculate the final marks. Till then, would you like? I would want a review from everybody. How was the quiz and everything? You can start with Debayan.
Yeah, it was a great quiz. I'll be a little frank. Some questions were a revision because I just happened to give a quiz in science a little earlier. And, the quiz was great. The great quality quiz. Yeah, love giving the quiz.
Yeah, thank you. Naveen?
Yeah, it was really nice. New experience. The quality of questions were really amazing. The way you have, correlated stuffs, the video ones actually.
Yeah,
it was really nice. I enjoyed it.
Thank you. Kapil?
Yeah, Kunj, the video as always amazing. I just have one problem with this thing. You said it was clinical and you have asked PSM logos, guys. But other than that, amazing. Amazing.
Yeah. Okay. Arun?
Hello.
Yeah. How was it?
Yeah. Just like after the prelims, I'd like to reiterate that this quiz emphasized the importance of revision. You've heard of most of these things, but recollecting it during the exam or the quiz is important. That is through repeated revision. Yeah.
Correct.
And the movies are also brilliant. Yeah.
Oh. I'm glad you all liked the video. Arun?
Yeah. I just spoke.
Sorry. Vignesh?
Hello. Yeah. So first of all, you were a very cheerful quiz master.
Oh, thank you.
Many grim quiz masters we've seen. Yeah, I can see the amount of creativity and work you have put in forming these questions, because it's not just taking some things from MCQ books and just putting it up as questions. Because these kind of questions, I think only if you think can come up, you can come up with. You might not get this anywhere, like the video questions and all. So hats off to you, sir.
Oh, thank you. That's great to hear from you. And Sneha Lakshmi?
The quiz was great, as others had already mentioned. Especially the video round was fabulous. And it just made us be everything we knew, but we couldn't answer it. It was still here, but it was not coming out. And you were so great, like you made us think differently, and it was so nice. It was a great quiz.
Wow, thank you. I'm glad you all loved the questions. The video was one of like my own creation. I did this all back in my COVID time when I was home and everything. nothing to do. So I don't know, my mind worked in that direction. So
Coach, actually, I also like the fact that you had an explanation round where you have to, the first round where you have to explain the entire process, and you did not include questions like name some specific monoclonal antibody, which is like this pure rote work.
That's of no use. Like what's in clinical practice, that's of no use only. You should know some logical
explanation part, even the dextrose question or the lipo A, that was a very cool question.
Thank you. So here
And also
I have
the way that your intent was to get knowledge through and not, put points, get the winner. That was for all of us.
Basically, you need to learn, like there is no winner or loser in this, because everybody is at the same level. Just like spontaneity and at that particular point of time, how your mind can act. That's will tell who is the winner or not. But you should learn something out of this. That was the main motto. So by the way,
And most of the quizzes, they generally be based on facts. It will be more factual, but this one was more not even concept. It was one step ahead of concepts. Like it was like a mini brainstorming session.
Oh yeah, that's it. By the way, so coming to the results, there is a tie between the second and the third participant. So like the second and third, like Kapil and Arun have a tie of 85 points, and Navin scored 68 points. He came fourth, and Debayan scored the maximum 120. So he came first. So coming to I'll just decide the second and third. I will just show the tiebreaker round. I'll just open one of the other PPT. Just give me 2 minutes for Kapil and Arun. 1 second.
Kapil couldn't have told that 10 points from 5 points.
Great.
1 second. I'll give you a video round itself. I have one extra made. So whoever answers all the three correctly, like you will have to just tell me who will answer it first, because otherwise just Kapil and Arun, I'll just project the video and then I'll project I'll project all the three questions simultaneously, and the person who first raises his hand, like which I can see, like just raise it on the video, and that person will get the chance to attempt. And if that person goes wrong, then we'll see what to do. I'll just show. It's from Ortho.
The title.
1 second.
Challenging the arm. It's going to be tight. It is tight. Umpire goes upstairs. Third umpire, it is.
I project the question.
And it looks very much like his. Look at that right arm. There's.
That is my.
Questions yet.
ये आखिरी विकेट है अगर विराट
Okay, so the questions are. So the three questions.
Yeah, I raised my hand now.
Okay, answer.
That was that dislocation of shoulder.
Okay.
Commonly name the dislocation of shoulder, commonly used management modality, as in the operation, or like
how will you treat it?
Closed reduction.
The name of the method.
The name of the method.
Answer it only if you know. Otherwise, Kapil will get a additional point. Like he'll answer. Otherwise, if you cannot answer.
Okay. The forgotten muscle of rotator cuff is infraspinatus.
And the two methods.
Was it Kocher method for the second one?
Explain that.
Closed reduction.
No.
Wait, is it the? Oh, you want me to explain that maneuver which they do to reduce the dislocation?
Yeah.
Axial.
By the way, third answer is wrong. So.
Okay. Axial traction and counter traction something.
Doesn't.
I'm not able to remember.
Kapil, do you want to and snatch away the 10 points which he has?
Yeah. So first is the shoulder dislocation.
Yeah.
Second is Cocker method, which is you put traction, axial traction, external rotation, abduction, and then medial rotation.
Correct.
So that relocates it, and then the
Okay.
forgotten muscle of rotator cuff. Even this is okay, since he said intraside is wrong, I'll probably go with supraspinatus.
No, even that's wrong.
we both told the similar answers then.
Okay, so but since Kapil mentioned the second answer correctly, so we'll get 10 points more. So it's the last. Yeah, the first question doesn't get counted itself. Both of you answered.
Okay.
Second was modify coccus, the TEAM, team which answered.
Team.
Third is subscapularis, which is a forgotten method. And you want to guess the two methods of testing? This is usually asked in your final practicals.
Subscapularis, two methods of testing is.
Anybody
you
else?
have to tell the name of the method.
Yeah.
Name of the method of testing subscapularis.
Yeah. Belly press and basically you press. Yeah.
No, hugging,
not beer
hugging a person.
Yeah, the bear hug. Bear hug, beer and sorry, not the beer can, the bear hug. Then there are this. Do you want to attempt the bonus question? I just had it. So I just tell the two methods.
Schaffer's fracture.
I'll just it's beer hug, belly press, and arm lift off. Like lift off like behind and stuff. So just an extra question. I just had. Do you all want to attempt? Anybody, or should I just leave it?
Yeah.
Attempt. Okay, then tell me which cast will you apply in Schaffer's fracture and why? Anybody can attempt.
Glass folding cast.
No, that's for scaphoid fracture. This.
Yeah.
Schaffer's fracture, which we just saw in the.
But it's an intra-articular fracture. Don't you do like internal fixation?
But you. Yeah, you can. But post internal fixation, which cast can you apply?
Or I thought it's like a trick question, like you don't apply a cast.
You yeah, even that's correct. But even after applying, you also do a cast, right? Like basically, there are only two options: below elbow or above elbow.
Above elbow, probably.
Why?
Because you have to stabilize one joint proximal to the.
Okay. That's but any specific reason for that? Like about the muscle attachment of anything?
Yeah, the muscle. So,
which muscle gets attached to the radial styloid?
Brachioradialis, and it is origin is above the.
Origin is in the lateral epicondyl of the humerus. That's why you need to stabilize that. Otherwise, there is no point of doing below elbow. So that was it. So now the winners are the first. 1 second, I'll just So winners are the first prize goes to Debayan with a score of 120 points. Congratulations. The second winner, the second winner is Kapil with 95 points, snatching 10 points from Arun. And Third is Arun with 85 points, and fourth is Navin with 68 points. So thank you, all of you, and hope you all had a great evening. Okay.
Yeah, thanks, coach.
Thank you so much, sir. It was a great evening.
Thank you. See you all.
Thank you.
Bye, sir.
Thank you. It was amazing.
Bye bye.
Bye bye. Have a nice day.
Yeah, you too.